The tumor exclusively seen in the parotid gland is. Which tumor is exclusively seen in the parotid gland? A. Mycoepidermoid. B. Adenoid cystic. C. Warthin. D. Pleomorphic adenoma. It is Warthin's tumor, which is exclusively seen in the parotid gland. Fish classification is used for A. Paravertebral tumors, B. synovial sarcoma, C. glomus tumor, D. retroperitoneal tumors. It is glomus tumors. Glomus tumors, fish classification is used. Here you can see in the image. C1 means limited involvement of vertical portion of carotid canal. C2 means involvement of vertical portion of carotid canal. C3 means involvement of horizontal portion of carotid canal. So this is a fish classification used for glomus tumor. Best prognosis of all thyroid cancers is A. Papillary, B. Follicular, C. Medullary, D. Anaplastic. It is papillary. In cases of cancer best with HER2 amplification, when will you do fish? HER2 2 plus 1 plus positive, HER2 2 plus positive, irrespective of HER2 3 plus positive. It is HER2 2 plus positive. Most important prognostic factor of CA esophagus is A. Length of growth, B. The depth of involvement, C. Histology grading, D. Immunohistochemistry. Well, it is the depth of involvement. So correct option here is B. Depth of involvement. Which one of the following is not true about yeast? A. Rarely occurs in stomach and duodenum. B. Universally associated with c-KIT oncogene mutation. C. Size and mitotic index are best predictors of metastasis. D. Sensitive to imatinib. It is rarely occurs in stomach and duodenum. Increased level of 5-HIA is seen in which disease? A. Carcinoid tumor. B. Phenylketonuria. C. Phemochromocytoma. D. Gastrinoma. It is carcinoid tumor. In carcinoid tumor, there is an increased level of 5-HIA. Okuda staging is used for. Now, Okuda staging is used for hepatocellular carcinoma. A. HCC. B. Pancreatic cancer. C. Hepatoblastoma. D. RCC. It is hepatocellular carcinoma. Identify the triangle shown in the image. A. Callot's triangle. B. Hepatocystic triangle. C. Gastronoma triangle. D. Doom's triangle. It is gastronoma triangle. Most common presentation of bile duct cancer is A. Pruritus, B. Jaundice, C. Gallbladder enlargement, C. D. Weight loss. It is jaundice. Most common site of cancer penis is A. Glans penis, B. prepuce, C. shaft, D. coronal sulcus. It is glans penis. Recent FDA approved drug as a first line treatment along with platinum based chemotherapy is in stage 4 NSCLC. A. Erlotinib, B. Geftinib, C. Sorafenib, D. Crizotinib. It is Geftinib. This is Geftinib is a recently FDA approved drug as a first line treatment along with platinum based chemotherapy, that is cisplatin. Chang staging is used for A. retinoblastoma, B. medulloblastoma, C. Ewing sarcoma, D. rhabdomyosarcoma. It is medulloblastoma. Craniopharyngioma is a brain tumor arising from A. an Arquette's spouse, B. neurohypophysis, C. posterior pituitary, D. median eminence. It is median eminence. Most common pituitary adenomas are A. growth hormone secreting adenomas, B. ACTH secreting adenomas, C. TSH secreting adenomas, D. prolactinomas. It is prolactinomas. It is the most common pituitary adenoma. Most common intracranial brain tumor in adult is A. astrocytoma, B. metastasis, C. meningioma, D. oligodendroglioma. It is metastasis. Kaposi sarcoma is caused by A. HIV1, B. HPV16, C. HTLV type 1, D. human semen virus. It is HIV type 1. Soft tissue tumor of extremity most commonly metastasized A. lung, B. liver, C. bone, D. lymph node. It is lung. Most microsurgery is done for A. cutaneous melanoma, B. dermatofibrosarcoma, C. Squamous cell carcinoma. D. Basal cell carcinoma. Well, it is a basal cell carcinoma where most microsurgery is done. Most common type of soft tissue sarcoma in children is A. Embryonal rhabdomyosarcoma, B. alveolar sarcoma, C. liposarcoma, D. leiomyosarcoma. It is embryonal rhabdomyosarcoma. The tumor with high frequency of spontaneous regression in children is A. medulloblastoma, B. renal cell carcinoma, C. lung cancer, D. retinoblastoma. It is medulloblastoma. Pheochromocytomas, if extraordinary, are most commonly seen in A. posterior mediastinum, B. superior mediastinum, C. anterior mediastinum, D. middle mediastinum. It is posterior mediastinum. The idea of adrenal biopsy should be made after ruling out A. adrenocortical carcinoma, B. metastasis, C. pheochromocytoma, D. Cushing syndrome. Before you do biopsy, you should always rule out pheochromocytoma. So correct option here is C. Pheochromocytoma. Most common malignancy of vagina in infants and children is A. embryonal rhabdomyosarcoma, B. chondrosarcoma, C. melanoma, D. leiomyosarcoma. It is embryonal rhabdomyosarcoma. Fraze syndrome is due to injury of which of the following nerve branch? A. trigeminal nerve, B. vagus nerve, C. facial nerve, D. glossopharyngeal nerve. It is trigeminal nerve.